Al-Nas Hospital, where I was based. It's the last hospital fully standing in Gaza that offers a lot of the specialized services that are needed for the population. It was Gaza's second largest hospital after Al-Shifa Hospital. Al-Shifa Hospital was destroyed. Nasser Hospital was bombed while I was there. It was shelled by a drone attack, killing 2 patients and injuring several others, the floor immediately above where I was working in the emergency department. And since then, there have been subsequent attacks on Nasser Hospital, and currently it's essentially encircled. So it is almost like a tiny island that's not technically for evacuation, but staff are unable to reach the hospital safely. Many staff and patients have evacuated, and that is devastating. Some international NGOs have withdrawn from that hospital where they were providing essential services, and maybe MSF can speak more to that as well. And for us, for myself, having worked there and seen the intensive care unit, the pediatric intensive care unit, they have a specialized intensive care unit for children filled with injured children at full capacity. They've since extended it to have 3 additional beds. But I hear from my colleagues on the ground, the Palestinian pediatric doctors working in the ICU, that it's been at full capacity ever since I left. And every time one of the injured children dies, they immediately fill the bed because there's a queue of children that are waiting for the beds and that are dying as a consequence of not having access to one of the few remaining pediatric intensive care beds inside Gaza. So Nasser Hospital is currently at the same risk that virtually every public hospital in Gaza has encountered in the last 20 months. Al-Shifa, Al-Nasr Pediatric Hospital, where I used to teach, was completely leveled. You might recall Al-Nasr Hospital because it's different than Al-Nasr, just to clarify for those listening. Al-Nasr was the only general pediatric hospital in Gaza. You might remember the news last year of babies decomposing in their beds after the staff was forced by the Israeli military to evacuate and promised that the critical infants that required expert evacuation would be evacuated, and they were not. And they subsequently died and decomposed in their beds. This was all over the international media. That hospital is now leveled. I visited the site of that hospital. It's adjacent hospital, also a subspecialty pediatric, not a general, but a subspecialty pediatric hospital, where children with blood cancers like leukemia were treated, where children with chronic diseases were treated. Any child who needed subspecialty care would have been treated there. Rantisi was used as a military base for the Israeli forces. The Turkish Friendship Cancer Hospital, the only specialized cancer hospital in Gaza, was also used as a base by the Israeli military and subsequently flattened. There no longer is a cancer hospital in Gaza. Cancer services were moved to the European Gaza hospital, and in the last couple of weeks, the European hospital was encircled, forcibly evacuated after being attacked several times, and is now used as a command and control center by the Israeli military. So I honestly don't know how and if cancer patients in Gaza are receiving care at the moment. There were an estimated 11,000 people with cancer in Gaza prior to October 2023, and that applies across diseases. The dialysis centers were destroyed most recently in the last month. One of the main specialized dialysis centers in the north was destroyed. The Nasser Dialysis Center was destroyed. We saw it every day. It was charred. It was across the plot of land that was used as a mass grave when Nasser Hospital was besieged by the Israeli military. So I'm trying to paint a picture of a healthcare system that has been systematically targeted and destroyed. And from my perspective, it's a facet of ethnic cleansing of the Palestinian people, but that's not only from my personal experience and testimony. It's consistent across healthcare workers who have worked and humanitarian workers who've worked on the ground, and as well as UN experts and international human rights groups that have concluded that Israel is committing extermination and genocide against the Palestinian people, and most recently demonstrated by a UN report on attacks on healthcare and healthcare workers. 1,000, at least 1,500 healthcare workers have been killed to date in Gaza, including several of my previous students. So I had taught them when they were medical students. And I can tell your viewers right now, these are some of the most dedicated healthcare workers that I have ever encountered. I'm sure many of you have heard this before. This has made Gaza the largest cohort of pediatric amputees, home to the largest cohort of pediatric amputees in known history. And so it's no surprise that the very organizations that serve to protect children, like UNICEF, have described Gaza as the most dangerous place to be a child, and as well as a graveyard for thousands of children. And others have described it as a war on children. I can tell you, just walking through the intensive care unit where I worked, maybe that would be the best way to illustrate this. I can tell you that the last week I was there, in bed one, we had a 12-month-old that came in early morning on March 18th with multiple bowel injuries, injury to her chest. She was on life support when we took her off the ventilator. She survived. She kept crying, "Mama, mama, mama." Her mother was killed in the same attack that critically injured her. In the bed next to her, we had a baby that was a few months old who had been waiting to be evacuated for weeks. And as you know, medical evacuations have almost completely come to a halt. There's just a trickle that are able to leave with the support of certain governments. And without evacuation and proper diagnostic and therapeutic care, she will probably die too, if she hasn't died already. Bed three, we had Sham, 5 or 6 years old. She had injuries to her bowel, liver, spleen. They had to remove her spleen, diaphragm. She had shrapnel going in one side of her brain and out the other, giving her a stroke on the other side of her body. And Sham's mother and father were injured. When her mother finally came to visit her in the ICU, she said, "Please tell me the truth. I lost all my other daughters in the same attack, and I want to know if Sham will survive too." In the bed next to Sham was Yusuf. Yusuf's 5 or 6 years old, multiple injuries to his legs, including severing of one of the main arteries. He almost bled to death. He required chest compressions, so CPR twice in the operating room, and ultimately survived, at least till when I left. But the surgeons didn't think he would be able to keep his lower extremities. Just for context, and kind of in line with what Shayna was saying, a lot of the expertise and education has been a target of this military campaign. So a lot of the specialists in Gaza have now been killed. And amongst the two sort of complex orthopedic surgeons in Gaza, one was tortured to death and the other is in Israeli prison. So the type of expertise that's needed to care for children like Yusuf, you don't only need the space, you also need the expertise. These same atrocities continue to be committed. They just are being committed without the world's watch.